Okay, I think it's starting the YouTube live streaming.
People are still coming in.
Yeah. Got it. 7. Got it. People are still coming in. Good evening, everyone. We're going to start in just about a minute since everyone is still joining us. Let me make sure that the chats are available to everyone. Okay, I think I've enabled that. And we have the Q&A section. Okay, I think we can get started, right?
Yeah.
Okay, just give me 1 second. All right. Okay, good evening, everyone, and welcome back. We were on a summer break for 2 months, and we're back to hosting our general meetings. And thank you so much for attending, joining us tonight. And my name is Robina Nimbalkar, and I'm the Executive Director at NAMI Santa Clara County. Before we begin with the session tonight, I am just going to go over some of the updates at NAMI Santa Clara County. Our helpline is up and running from 10 a.m. to 6 p.m. Monday through Friday via phone as well as email. And we have after hours as well, after hour family support, which is available on evenings and weekends. Our support groups are all listed on our website. It's www.namisantaclara.org and offered over Zoom. Our educational classes, such as family to family, familiar to familiar, persona to persona, peer to peer, provider education classes. For more information, you can call our helpline number. It's 408-453-0400, and you can select option 1 for further details, and you can get on the interest list just to know when the next session is going to be. NAMI Basics, as well as NAMI Homefront, is on demand and on our website, so you can take it at your own pace. The FaithNet Mental Health 101, the next presentation is going to be on November 16th from 11:30 a.m. to 1 p.m. The community peer program continues to match via hospitals as well as self-referrals. Again, for further details, you can contact our helpline number. And for a little bit more exciting news, NAMI Walk Silicon Valley is in about, I think, 25 days on October 7th, Saturday, October 7th. And this is going to be a second year going back in person after the pandemic at the History Park in San Jose. So I'm really hoping that all of you have already registered or plan to register and attend the NAMI Walk Silicon Valley. Our keynote for the NAMI Walks is the president of 49ers Enterprise, Parag Marathe, and our honorary chair is Supervisor Cindy Chavez. So if you need more details about the NAMI Walk Silicon Valley, you can go to our website. It's namiwalks.org/Silicon Valley. I will also be posting this website in the chat so you can have more information about it. Okay, so that's with the updates. I am now going to hand it over to Maureen Milo, our NAMI Santa Clara County's board member at large, to introduce our speaker for tonight. Over to you, Maureen.
All right. Good evening, everyone. Tonight, our speaker is Dr. Ken Duckworth. He has served as NAMI's chief medical officer since 2003. He is board certified in adult psychiatry and child and adolescent psychiatry, and he is an assistant professor of psychiatry at Harvard Medical School. He was previously acting commissioner and medical director at Massachusetts Department of Mental Health. Ken has worked as an assertive community treatment team at an early psychosis program, at an elementary school, at a health plan, and with people who are unsheltered. His passion for his work comes from his loving dad, who had bipolar disorder. I'm thrilled, Ken, that you can be with us this evening, even though I know it's a little late over there on the East Coast. And Ken is here to talk to us today about his book and how even after all these years in the behavioral health sector, he is still discovering the new meaning to the words of "You Are Not Alone," which also is the title of his NAMI book. Before we get started this evening, I just want to mention that in the group chat, you'll see a Q&A section where you can put your questions that you might have and that you'd like Ken to answer. And Ravina will be monitoring them. And Ken will, after Ken's presentation, Ravina will ask those questions to Ken. So now I'd like to turn it over to Ken. And thank you again, Ken, for being here.
Hi, everybody. Thank you, Mort. It was past my bedtime, so let's see how I do. Right. When I wrote the book, I'd get up at 4:30 in the morning and I'd write for 2 full hours, walk the dog, listening to someone else's mental health book. Then I'd go back and type again. Then I'd do Zoom interviews with people. So I just want to say it's really nice to be here. Let's see how I do this late at night. So if you haven't seen NAMI's first book, it looks like this. You Are Not Alone. And I asked them for a journey or pathway metaphor. And so they delivered on the cover with that. I'm going to be happy to take your questions. I want to tell you a little bit about the book. I really felt that the largest mental health organization in the country, ergo the world, deserved its own book. I wanted people to be able to find NAMI in bookstores, in libraries, and on the web on Amazon. And so the book has been pretty wildly a success. I focused on real people who use their names, who share what they have learned. This was a fairly radical construct. And when I put together the book proposal, 5 publishers bid on NAMI's first book. So this was not printed in my basement with the mimeograph machine. Like, there was real competition for our book, and I'm very happy to say that we delivered it on time. We've sold a lot of books. We've sold over 41,000 books, and I had a person ask me today, what kind of deal could you give me if I could buy 1,800 books? That's with every guidance counselor in one big state. That's not a done deal yet, but in under a year, I think it's pretty safe to say at a year, we'll be at 43,000 books, which our agent says is astounding. One of the reasons I wanted us to have a book is that so many people told me they wish I had found NAMI earlier. Their child, their relationship would be better, their marriage might be saved. They might have made a difference in the course of someone's life. So I just felt like when you go into Target and you see NAMI's first book, when you go into the library and you see our book, when you're in Barnes and Nobles, and we've sold books in all these places, it's an opportunity for people to learn about NAMI more quickly. I was advised to write 2 different books, one for peers and one for families. And I don't know how we can do this through the chat, but one of my intuitions was to do it all together. And I'm going to say I interviewed about 80 people who identified primarily as peers and about 80 people who identified primarily as family members. Now that number is 160, and that's bigger than 130 people I interviewed. And what people told me was they were both a peer and a family member. They had their own experience and they loved someone who had an additional mental health experience. So I decided to value all these perspectives and to write what I think is the first book that integrates the true peer perspective, the true family perspective. And while I am a psychiatrist, I didn't want to ignore the research and professional angle. So I also integrated questions and answers that I get. Do I really have to take these meds forever? How do you talk to somebody who doesn't want help? What is the wellness recovery action plan? And so to me, I wanted to make this kind of the go-to mental health book that was easy to understand, where real people can be related to in the book. I interviewed people from 38 states, about 10 from California, maybe 8 from California, people of 11 different races and ethnicities, 25 different religious affiliations, 50 occupations, and people who'd been incarcerated, people who'd been homeless, people who had lost touch with their families, people who had lost their children to social services. I mean, I really found people, volunteers, and every person in the book that I interviewed appears, there's a quote from each person in the book. So I felt like nobody had ever really asked real people what they had learned. And this is the joy of what I've learned at NAMI. So, my dad had bipolar disorder. I became a psychiatrist to try to make sense of what his illness was. We couldn't talk about his illness. And so, this kind of drove a non-science kid. I was not a science whiz. I only went to the medical schools that didn't require calculus. I was really interested in storytelling and what the illnesses meant to people. And it's no surprise that I wrote this particular book, where real people, their first person experience is really valued. And so people taught me a lot about how peers make a difference, both for peers with people with lived experience and how families helped each other. People told me that the person who helped them the most was the person next to them in the hospital, or the peer specialist who was helping them with their challenge. Many people told me that becoming a peer specialist made the key difference for them in their journey. So it's been a great experience. I thought I was the most radically peer-focused person, psychiatrist in the country, but in listening to people, I took a chapter. When you write a book, I'm a rookie author. I'm going to be a one-hit wonder. I don't intend to ever write another book. You have to write a book proposal, and you send it to an agent, and then he sends it out to the publishers, and the publishers bid on it. And in the book proposal, I had the power of community. So I interviewed someone from Fountain House, the first clubhouse in America, from the 1940s, and now there's 400 clubhouses all across America. So to me, I listened to the people in my Zoom interviews. This was all a gigantic pandemic project. And they taught me that the chapter had to be called The Power of Peers and Community. So even though I was super on that end of the spectrum, even I realized that I hadn't quite gone far enough in considering and focusing on the peer and peer specialist aspect of the work. So it was a great honor to write NAMI's first book. Not far from Santa Clara is where the first NAMI meetings were held in the 1970s. I think NAMI had a lot of roots. The first group was called Parents of Adults with Schizophrenia, PAS. And what was interesting about that is NAMI really starts as a family organization, because psychiatrists, like my predecessors, blamed the family for their children's serious mental health conditions. And while I am a family member, I've always been very interested in the peer experience. When NAMI really began to take on the peer experience, and we're now the largest group of families, the largest group of people who live with conditions in the country, ergo the world, that's when they recruited me. And so I was brought in because I was always interested in both perspectives and how these perspectives often could get things done, like 988, like mental health parity, like coordinated specialty care, right? These are all things that we did together, and how those perspectives were important because we could learn from each other. And as you know, in family to family, people learn about individual experience. And I think the peers benefit from learning about families. So I made a decision to do it all in one book. I ignored people who thought it should be two different books. And as I mentioned in the beginning, I don't know if you can do this in the chat, but how many of you would say you're both a peer and a family member? Because I found that to be relatively common. And so the idea of this distinction really broke down. When people said, I'm speaking as a dad now, that quote or lesson or transaction was in the family section. When people said, I'm really speaking as a peer now because I have schizoaffective disorder, then that quote went into the peer section. So I tried to listen to a lot of people from their perspective and foster what I think is the most integrative book out there with real people, peers, families, and professionals. And of course, when you hang out with professionals, you realize that a lot of them are family members and a lot of them are peers too. And some people are both family members, peers, and professionals. But this isn't that book. I didn't write that book about professionals who were both family members and peers. That's another interesting project. I wanted to write NAMI's first book. I wanted us to have the copyright. NAMI has the copyright. I wanted to make sure all the royalties go to NAMI. So I don't give these talks because I make any money. I give these talks because I want people to be able to chat with the author of your first book and, ask me any questions you might have. There is a second book coming, and this is very important. It's a book for parents, for young adults and kids. And I had no intention of writing that book, but I recruited a lovely young woman to be my understudy. And I called her and I said, would you like me to make your career and ruin a year of your life? And she said, oh, that's an interesting opening line. And I said, they want me to write the next book, but I don't want to write it. And this is the only book I ever wanted to write, was NAMI's kind of definitive book. And so she's working on this book. Her name is Christine Crawford. The book will be out in 1 year. And the current title is You Are Not Alone, A Parent's Guide. You are not alone for the next generation. It's going to be something like that. But back to the cover, it'll have this same kind of pathway model, but it'll have different colors on it. Same publisher. Publisher is amazing. The woman's name is Molly Stern. Molly edited Michelle Obama's Becoming, which is the best-selling biography in American history. She then formed her own company, and the company is called Zando, after her children's named Xander and Owen. And when she read my proposal, she called her board and she said, this is the real thing. We've got to buy this book. And it was the first book that she bought in the Zando publishing press. So the book does not have typos in it. It doesn't look, it's basically beautiful. One woman came up to me at one of my book events and she had all these stickies in the book. And I said, oh, what are those stickies? And she said, those are all the typos. And then she paused and she said, no, those are things I go back and read because other people have learned things that I'm still trying to learn. And so, I think this is a book people give to each other. They pass to each other. I just want to say, it was really a privilege to write your first book. And I'd be happy to take any questions you might have about our first book. I see a question on CIT training. I interviewed several people who became CIT trainers for the book. And I interviewed a police officer who developed PTSD, who then went on to become a trainer for police officers. He's fighting very uphill in a culture that doesn't like to acknowledge trauma and vulnerability. This is what he told me. And I think that the crisis intervention training is a necessary but not sufficient model. We need more mobile crisis response. As you know, 988 has begun the process of giving people a mobile crisis response. Peer specialists to be professionally recognized for emergency response. I interviewed a woman named Tara Carter. I'm flying to Atlanta on Thursday. She's on the panel with me, and there's a little PBS show that'll be about people in the book. She's in that. She is a peer, but she's in Georgia, and I want to emphasize this. She's a peer specialist on a mobile crisis team in Georgia. Georgia was the first state to do this work. This is all state by state. While I'm no expert on California, my limited understanding is California is one of the last states to attend to the peer specialist role. Rovina or Mort, you can correct me if I'm wrong, but that's my understanding.
That's true.
Georgia had figured this out 25 years ago. I want to emphasize it's not last week. So California is still, slow to the game, I would say.
You're right.
Don't feel bad. Massachusetts was really the last state to adopt crisis intervention training for police officers. And so, we have this reputation as this super blue state. Well, it turns out none of the police departments wanted to be trained in de-escalation. So there it is. All I can say is a lot of these things are local culture, they're advocacy. I got to know your Jessica Cruz at the American Psychiatric Association, which was in San Francisco this year. And, I began to get some understanding of what she's trying to do as your state leader to do advocacy in the public domain. So I think the answer, I don't see police training merging with peer programs, but peers, multiple people in the book, including those who were mistreated by police officers, go on to teach police officers. A woman who was told by a corrections officer when she left prison after a manic episode, she's in the book, her name is Kimberly Comer, and the correctional officer said, "I look forward to seeing you again soon," as he drops her off at the shelter. 7 years later, she is teaching a class on correctional officers de-escalation. And she realizes it's that man in the back of the room that told her that. And she said, I think that's the guy who said he was going to see me again. I'm going to go help him out with that. So she became a peer teacher of de-escalation for police and correctional officers. Oh, questions about peer specialists. So different states define it differently, but Georgia is the definitive best state. So connect, set up a call with people from NAMI Atlanta, NAMI Georgia. They've been working on this idea that you take your experience of living with a mental health condition, bipolar disorder, schizophrenia, schizoaffective disorder, PTSD. You take that experience and you become part of a treatment team. You don't do diagnoses, you don't prescribe medications, you don't do psychotherapy. What you do is you ride along with people and you share with them your experience. So the peer specialist might be the person taking someone to a job interview and saying, "Let me tell you about my job interview challenges. I had panic attacks in the car beforehand." So the idea is there's someone like you who does this work in the context of being open about having a mental health experience. That's a so-called peer specialist. I had Clarence Jordan write about his experience in becoming his peer specialist in the back of the book, and he discusses basically, here's how to become a peer specialist. How do I use my experience to help other people? And that's essentially the rough definition of a peer specialist.
We do have a program that we developed at NAMI Santa Clara County called the Community Peer Program, very similar to the function of a peer specialist, where we match an individual with a mentor for a period of 4 months. And it's a similar function, like you help them with, job search or job interviews, or we set goals for them. So if anyone's interested in this program, do feel free to reach out to us. It's a very similar program that we have. And we do get some grants from some big organizations like Cigna.
So Rovina,
yeah.
When you take that program, you become what? Like, what is do you get a certification at the end of that?
No, there's no certification because it's a program that we've developed it here at NAMI, Santa Clara County. So the prerequisite is to be able to take peer-to-peer program. So you take the peer-to-peer program, and then you become a mentor, and then after that, then you go on to you get assigned a peer for a period of 4 months.
So the peer-to-peer is an education program.
Yes.
And I interviewed the woman who invented that program, Catherine McNulty, for the book. I also interviewed the woman who invented Family to Family, which was our first program. That was Joyce Burland. So what I tried to do is go back to the people who created these programs and really lay out how did they create it. So Catherine really told me that NAMI was very family focused, and it took them a while, about 20 years, to really take on the peer opportunity. And that's about when I was recruited, because people knew I was into that. So peer-to-peer is an educational class. After you do that, you can take this class. And what's it called again, Ravina?
The Community Peer Program.
Yeah, okay, Community Peer Program. Great.
And we take, you can come through a self-referral, or we also have staff at El Camino Hospital. We used to have staff at Stanford Hospital too, but you can come in through self-referral by calling our helpline number.
One of the advantages of California not having figured out peer specialists is you can help shape it. Because while they're one of the last states, we're pretty organized now, we, NAMI, right? We can have a lot of input into what do we want to see. Does that make sense?
Yeah.
Now,
I agree.
families are also peers. I want to emphasize this. So you talk to somebody else in your family, the family group, they're your peer. But for these purposes, I'm using people who live with a mental health condition as a peer.
So, Dr. Duckworth, we have a question from Senator Jim Bell in the Q&A section, and I'm going to read out the question here. How many states have funded peer support programs via Medicaid? Newsom voted the bill 2 times because the cost to Medicaid. He finally signed the 3rd bill, SB 803. Are there any studies showing the impact on homelessness?
On homelessness, I think homelessness is fundamentally a problem of housing. So I don't think peer specialists is directly connected to the problem of housing. So this would be the whole question of housing first versus, how much group housing you build versus how you construct that problem. And I know homelessness is a big problem in California. I'm friends with the Healthcare for the Homeless operation here in Boston, and we have this same challenge as well. Expensive, interesting places to live that don't have affordable housing, right? You're in Silicon Valley, San Francisco, Boston. These places really are challenged by this. So I don't think peer specialist constructs are directly related to reducing the problem of homelessness. Although, if you talk to anybody who works in the homeless population, and I did some work in that area, peer specialists might connect with a person who sleeps on the streets and say, I was once in this situation like you. Does that make sense? I was once here and now I have my own place, but you have to have the housing to get them into it, right? So, and I know there's a crisis in shelter beds, that sort of thing. So it's an extremely difficult problem all the way around. And I know you have Laura's Law, right? Which is, kind of a court-ordered treatment. I interviewed a man who that model helped in Texas, just so you know. I don't take a position on it in the book, but I was trying to gather a lot of different perspectives. And this was a man who didn't see that he was ill. And in Texas, he finally got a court order. He's now a social worker and going to become a peer specialist. So he wants to help other people through the lens of having had a mental illness, being hospitalized, being homeless. So I guess I would say it's related, but not directly related.
There is a comment here, just in relation to what you had said before. Our affiliate had one of the first peer-to-peer teacher trainings with Catherine in 2003.
Oh,
So,
fantastic.
Yeah.
Yeah, Catherine, I did a book event with the people from Rhode Island with Catherine. She's still doing well. And, it was a big accomplishment for her to pull that off because she felt at the time NAMI was so family focused. And that was the beginning of trying to integrate the peer perspective. So I reached out to her and, just made the connection with her because I felt like she was really doing us a favor. NAMI is amazing. It's not only families, it's not only peers, right? It's amazing because the power of both is much better than either alone. Now, Mort mentioned the point, you can order the book anywhere you want. We've sold 21,000 books on Amazon. Jeff Bezos became a billionaire by offering it for $17.40. At a bookstore, it's $28. So it's all good. If you buy the book, it helps NAMI. If you want a signed copy, just let Ravina know, and I write little book plates and walk to my little library. My little post office, and I mail book plates all across the country. So, I've mailed 300 of them to NAMI Baltimore, and I've mailed 10 of them to Chico, California, I think. It's all good. I'm happy to do it. I consider it a real privilege. But if you want to learn about Catherine McNulty's journey, her personal journey. Now, none of you saw me on CBS Good Morning, but when they read the book, the staffers read the book, they had Gail King and her people ask me Catherine's story because it was so cool. And her story was she had young kids and she could not run her kitchen, could not run it. And she goes to a peer group and the person says, I've got 2 words that are going to change your life, Catherine. She said, what's that? The person said, paper plates. Do not worry about running your kitchen. Do not worry about all those piles of dishes. Raise your kids, and then you can work with them later on. You can work with the kitchen later on. Paper plates. That's a good example of something that a psychiatrist, psychologist wouldn't say to someone that you learn in the peer world. I was never trained about service dogs. I was never trained about how a dog could regulate a schedule of a person with bipolar disorder. And this was all wisdom that people shared with me, right? Because I felt like this was the missing piece. The idea that you've lived with something for a decade, or you've loved someone who's had something for 20 years, and no one ever asked you what you learned. What did you learn? Like, to me, it was the most obvious question. But I worked on it for 10 years in my mind. So just so you know, it's not like I had this all prepared. But when COVID happened, I was quickly on CNN. I was on TV a lot, and people were asking me about what helps people. How do people recover? And I had this little light bulb. I'm like, oh my God, that book I always wanted to write for NAMI. Now's the time. And I called our brand new CEO, Dan Gillis, and I said, Dan, I want to write our first book. I'll donate all the royalties to NAMI and the copyright. And he said, go. So within a year, the book was in process pretty actively. So it was a great experience all the way around. And we got a little lucky that the silver lining of COVID made mental health a we thing, so that there was a market for this book. Had I been able to pull this off 10 years ago, I don't think anybody would have bought our book. Maybe a few people within NAMI, but people are buying it in the general public. I get emails from random people who read the book and it really made a difference for their family. This is exactly what I was hoping for.
We have a comment here. Just wanted to say thanks to NAMI Santa Clara County. Rocks, very happy to have donated. Many, many should, and appreciate everything NAMI has done for my family and me in my own journey, whether it's family to family, peer to peer, volunteering, meeting with peer friends. Thank you very much.
Yay. See, this is the beauty of our little community. And, I would ask that person, did it take them a long time to find NAMI? Most people say yes. And this is the idea of the book. You describe a problem and someone says, let me give you our book. And you might not want to start the first day, but you might look at it. You might you might begin to say, okay, wait a second, there's all these real people just like me, people from all over the country, dealing with different challenges of culture and identity, integrating that with mental health. So that's great. That's very nice. That's super fast. Family to family first. Great. So did a practitioner tell you about NAMI? Because I've met people that the first social worker they meet with tells them about NAMI, and I met with people that have had 10 professionals and nobody tells them about NAMI. So this is another project, right? How do you get this on the consciousness of our practitioners?
We're also lucky some of the hospitals will have a kiosk with NAMI information in it.
Well, you're putting that information in it. You're running the kiosk. So this person's comments that NAMI-SCC rocks. Yay. So I hope you soak that in. It's great.
Any other question? If anyone wants to raise their hand, feel free to do that, to ask a question verbally, or you can put in the chat or in the Q&A section. I'm happy to, put you on the speaker.
Ken, for you, what was the biggest takeaway? I know that could be anything or everything, but
The
what's this
biggest
with you?
takeaway, I asked every person at the end of 130 interviews, what was this conversation like for you? Knowing that you're going to be using your name in a book that we're going to sell 100,000 of these books, right? The book is going to be out there. They're doing another printing in hardcover, not going to paperback. It's already been resold in Mandarin. It's been resold in the United Kingdom, right? They're looking at a Spanish publisher. Like, we did something. And I said to them, are you okay with this interview? Was this upsetting for you? To a person, they said, it is so fantastic that what I went through could help someone else. This idea of turning pain into purpose is very profound, and virtually every single person talked about it. That was really powerful. And I mentioned how the peer lessons were even stronger than I had intuited, and I had it at 10 out of 10, right? And so it's 11 out of 10, how strong the peer community, someone like you, is. And the other thing I learned is you can blow out your elbow tendons by typing all the time. And so I met this lovely physical therapist, and she said, I showed up with her and I said, yeah, I got these terrible pains. She said, are you writing a book? And I said, I did, right. I'm writing a book right now. And so I would go twice a week and she would work on, my tendons. So, basically by doing anything repetitively, you can over tighten things. So I learned it's very hard to write a book. I built a team to help me write the book. And I just want to acknowledge that while it's my name on the book, the whole team, our whole community helped. Like, I had, these two young, bright kids helping me with quotes. And I'll say that quote was really profound. Hang on to that quote and give it to me in 3 sentences, 8 sentences, and 12 sentences, depending on the length of the book. But that's the message I want to convey. So,
Well, I think it was the magnitude of what came from the book itself, right? That sort of community, that NAMI village, so to speak, that you were
Yeah.
putting into print. That's what you capture when you read the book.
Right. And I see there's another question. How do you manage over medication and weight gain? So one of the things in the back of the book, I went to America's leading experts, because who cares what Ken thinks about some of these questions? Like, I have my own ideas. So I went to the 2 leading people on medical self-care, right? One's at Hopkins, and she talks about how to manage your weight gain with antipsychotic medications, right? She's an expert, and she gives that answer. And you can also look her up and follow with her. And then another woman who's the leading expert on smoking cessation for planet Earth with a mental health condition, with a psychosis. She answers the same question as well. So she answers the question about how to quit smoking for your health. So what I'm going to say is, collaborate with your doctor. If you feel that you're being over medicated, make that clear. You should be a partner in a shared decision with the person, and not simply, be a recipient. And some medicines cause less weight gain than others. And so you can have that conversation. Like, it is well known, Zyprexa is relatively effective and relatively most likely to cause weight gain. So to me, this is a conversation you have with your practitioner. Obviously, how much you move, and do you move with other people in a community? It's pretty well been shown going to specialized program for people with mental illness to work out is not effective. Going to the Y, connecting in the world, that's the most effective way to manage your health. The other thing is, you need, if you're having weight gain from medications, you have to have certain things you're monitoring. That's all listed by the doctor from Hopkins. You have to be checking your hemoglobin A1C to make sure you're not developing diabetes. You have to work with your doctor to make sure. And all of it is a risk-benefit assessment. Is this medicine worth the side effects that I'm having? Should we switch to a different medication?
Any other questions? Okay, I do see one other question. are you aware that we are working with Don Brown, our National Helpline Manager, to solicit NAMI referrals from Employee Assistance Program? The program is being piloted with Google employees nationwide.
Well, what I will say is Dawn Brown is a treasure, and I interviewed her, and she told me one of the most compelling stories of anyone in the whole book. And I'll just leave it at that. And you can, read about it if you're interested. She's an amazing human being, runs this enormous helpline with hundreds of volunteers. And I had heard something about this program, about soliciting NAMI referrals from EAPs, but I wasn't aware that it was being pitched with Google employees. So it's not a go, it's just an idea with Google, like we're pitching it to Google, because I had not heard that. The helpline is a wild success. Really, we keep adding volunteers, we keep doing more and more calls, and we're not the crisis prevention lifeline, right? That's 988. 988 has been handled, but resources, where to go, how to problem solve, that sort of thing is what we're doing. So that's great. And I'm delighted that you're working with Dawn Brown. Please tell her I said hello. And she's one of our shining lights at National NAMI. She's a treasure, and she's really smart.
Anybody else have a question before we let Ken finally say goodnight? As we head towards
we have Uday. He's raised his hand. Let me allow him to speak.
Sure.
Uday, you can unmute yourself. Yes.
Yes, thank you. Hello, Dr. Duckworth.
Hello.
Uday Kapoor. I'm currently president of the board in
Congratulations.
Santa Clara County. So recently we've had a problem with HCA shutting down one of the acute care psychiatric hospital facility in Good
Is that
Sam
Health
Hospital.
Corporation of America, HCA?
Yes,
Okay.
yes. So there was a tremendous reaction to that because as it is, we are very short of beds.
Yes.
And so this was not really expected, and we didn't get much reaction from a lot of the folks, up and down, all the way to the governor's office. And we tried, we had lots of, so I actually am also part of the President's Council, NAMI National President's Council.
Yes.
And I had a meeting yesterday and I raised this issue, and all the other presidents said, or many of them said, we have the same problem, in Virginia and in California and UCLA. So they all are saying, this needs to be really showcased or whatever at the highest levels. So we looked at it as a parity violation because, here they're expanding.
Yes, of course, they're expanding cardiology wards because they make more money.
Correct.
Yeah, and you had a big parity lawsuit in California, which I'm sure you're well aware of.
Yes. So actually, Senator Jim Bell, who's also online, or at least he was, he played a big role in legislation in California about parity.
And
Good.
he actually has a question here that he just
Okay, go
posted.
ahead. Let
Where
him
is
ask.
parity law at this point? And Senator Jim Bell, if you want to speak, I can.
So let me just talk to Uday for a second. Right.
Yes, go
so
ahead.
this is a national problem, and this gets back to the reimbursement rates for the Center for Medicaid and Medicare Services, because we've allowed mental health to be run largely in part by for-profit entities. And they do the math, and the math ends up the same way. So to me, one solution is, I just met with the Center for Medicaid and Medicare Services, and I talked to them about reimbursement being inadequate in the mental health space. And that contributes to social workers not taking insurance, not taking Medicaid, and to hospital units being closed. I want to emphasize, I think this is about payment. And so the beankeepers, these operations, notice that the cardiology services make money and mental health loses money. But none of that is written in some biblical law, right? It's how much they're paid for. right?
Correct.
And the Center for Medicare and Medicaid Services, CMS, decides like that the mental health is less valuable.
Yes.
Now, the
Yes.
rates are negotiated by health plans. So Blue Cross of California, who Kaiser, I think we're on the losing end of your parity lawsuits, might be interested in a good advocacy conversation about the payment structures, because the third-party payers like Blue Cross or Kaiser are paying HCA. And
Right.
somebody at HCA has said this isn't making us any money.
Right.
That's a problem.
Yes.
That we have a system that's set up to make money, first of all, is a embarrassment.
Yeah.
And
My
second of
wife
all,
is a pediatrician, and there's a similar issue with pediatrics.
pediatrics, absolutely true.
Yes.
Absolutely true. This is about money.
Yes.
Unfortunately, we just want to help people and do advocacy, but at some point, it gets to be a little more nitty gritty. We got to fight
Yes.
for more money.
So I will let Jim Bell speak if he gets a chance. He can articulate the issue very well.
Well, in this case, we have a hospital, which is a big 400, 500 bed hospital that wants to close down. They have closed down their psychiatric inpatient, and have then decided to apply for a development with the city hall for 1 million square feet of additional space in an existing hospital, and like you said, to add the profitable elements that make them money. I mean that's the shamefulness of it. And so they sort of like are saying, well, we're going to manufacture scarcity,
Right.
and mental health based on our profit desires.
And more
And,
people will be stuck in emergency rooms, right? There'll be all of that, right?
Yeah, and then they take, if patients come into the emergency rooms and they'll say, well, we can't admit you into the hospital. We're going to have to send you to the public hospital system.
Which is also overwhelmed.
They're gonna burden the public hospital system by they call the ambulance company or the EMS and then transport the people
Right.
Away from their hospital so they don't have to admit the person. So I think the question is there parity applied to hospitals in terms of their licensing, their federal eligibility
Well,
to get
EMTALA, is the federal legislation that you can't turn people away unless they're stable. So just look at EMTALA and whoever worked on the mental health parity settlement with, I think, Kaiser and Blue Cross of California. Those are people to ask this question. How did the judge rule? How is it stated? Because to me, this is a tremendous need. And if you are successful, and I can work with the national office to be in support of you. I'm not on the policy team, but I am the doctor for NAMI, and I like these questions.
Yeah.
We can support you and learn from you, because this is a national crisis, as Uday mentioned. It's a national crisis.
Yeah, it's manufacturing scarcity, and therefore they say, well, we don't have any beds, so we don't have to really. There's no options, so we don't have any place to put people. And therefore,
I also wouldn't hesitate to publicly shame facilities. We were able to reverse one such closure of an academic nonprofit in Boston, which had proposed to close its 24-bed unit, which doesn't sound like a lot of beds, but if you don't have them, you need them. And they were well-run beds with high-level care. And the CEO just said, we can make more money doing whatever. And so we beat them up very publicly. We went to the papers. We had rallies. It's a tremendous amount of work to get people to do their job, though. I mean, again, I want to emphasize, it's not like we're building new facilities. We're playing defense, right? We're playing defense on these very hard questions. So thank you both for everything you're doing.
Yeah.
And the people at, NAMI, Santa Clara County. I mean, this is very hard work, but you have to keep going. Build on that.
When I raised this at the council, the president from Virginia said, we need to reframe it as a discrimination, not just parity violation,
Yeah,
you know? So
parity is all about discrimination.
exactly, yeah.
Yeah, it's exactly right.
You know,
Thank you so much, Uday. Thank you so much, Senator Bell. We have
Thank
another
you.
question here. How do you approach a family member who's in denial to motivate them to get the help they need? And does a 5150 prevent someone from getting employed in some areas or careers?
So let's take anosognosia, which is the medical term for lack of insight, as opposed to denial. Denial implies a willful psychological resistance, which could also be true. So in the back of the book, I asked Javier Amador, who wrote, I'm not sick, I don't need help. How do you work with somebody who has anosognosia, that they literally can't see that they're sick? I also interviewed Bill Miller, who invented motivational interviewing. And I reached out to Bill Miller and I said, Bill, could you explain motivational interviewing for NAMI's first book? He said, I'd be so honored to be in NAMI's first book. So I went to two experts and I basically asked them, how do you approach this problem? Javier would say you have to focus on the relationship. Most important thing is that the strength of your relationship is the most likely thing to get your results. And Bill Miller would say the ability to listen to what a person wants, really listen, not tell them what they need, listen to what they want. So they're both in the back of the book, and then their resources that they selected are in the resource section. So it's not an easy question, but there are two people that are kind of leading this conversation nationally. Bill Miller on motivational interviewing. How do you motivate somebody to do something they're really not that interested in doing? And I'm not sick, I don't need help. And that's the LEAP model. That's Javier Amador, who has spent his life working with people who don't appreciate that they're sick.
Thanks for answering that question. Okay, we're getting closer to 8 o'clock, and I know it's getting very late for Dr. Duckworth. It's almost 11 p.m. there. So if you don't have any questions, I would like to thank Dr. Duckworth for spending the time with us and telling us
Thank
more
you.
about the book and answering all these questions. And
Yes.
Maureen, if you had anything to
No,
say.
I just want to thank Dr. Duckworth for taking the time to be with us this evening. Really appreciate it. And look forward to that second book, which you're not writing.
Thank goodness. Best of all, I'm not writing it, but it'll be out in a year. And all same concept. It'll be NAMI's copyright. NAMI will get the royalties from the book. It'll be in Barnes and Nobles and Target and Amazon all across America.
That's
So
awesome.
I want to thank you all. Thanks for having me. Keep up the good work. And if you want a signed book plate, let Rovina know. I wander down to the post office every week or two, and I just mail little book plates all across the country so people can have a signed book.
Yeah.
Thank
right.
you. And thank you for writing it. Really appreciate all the hard work you put
A
in.
dream come true is what I'd say. And my elbows are almost fully recovered.
All right, there you go. You can use it for something else now.
All right. Take care, everybody.
All right,
Thank you,
Have a
everyone.
good evening,
Thank
what's
you. Good
left.
night.
Thank you so much. Take care. Good evening.
Yeah, and thanks everyone for joining us tonight. I hope we can see you at the NAMI Walk Silicon Valley in about a few weeks on October 7th.